With the passage of Bill C-64, the federal government has committed to universal access to contraceptives and diabetes treatments.
A couple weeks ago, Bill C-64 received royal assent, and what that basically means is it's now law. The federal government to start working with the provincial governments, really to ensure that every Canadian has universal access to all the medications they need in these two categories, so in contraceptives and in diabetes. They've made a list of medications that they've proposed as a starting point, but of course it is a starting point, and while they, in the bill, talk about first dollar single payer coverage, public coverage, there's still a lot that isn't really entirely clear and that has to be discussed between the federal government and the provincial governments. And so they've indicated that there may be an opportunity for patients to opt in or opt out, provinces to opt in or opt out. The list of medications is a starting point, but they're really committed to ensuring that Canadians have access to medications in these two categories, contraceptives and diabetes, and then to be discussed between the federal government and the provinces. Pharmacies are really generally funded through the prescriptions they dispense. And that not only covers ensuring that our shelves are full and that we have inventory in the stores, it also pays our staff, it pays our rent, it keeps the lights on, keeps the doors open. So when we think about the costs that it takes to operate a pharmacy, we're really relying on the funding for medications. And typically, most public programs tend to reimburse at a lower rate than a lot of private programs. And so there is definitely an impact to the pharmacy at the pharmacy level. And, we just want to make sure that we're able to continue to sustainably operate our business and make sure that we can be here for the communities that we serve and continue to offer the services and the accessibility of the services that we offer to our communities and our patients.